How to identify prediabetes symptoms. Before people develop type 2 diabetes, they almost always have prediabetes. This means that they have blood glucose levels that are higher than normal, but are not yet high enough to be diagnosed as diabetes. Prediabetes is a significant risk factor for type 2 diabetes and is also associated with an increased risk of cardiovascular disease. Luckily, if prediabetes is caught early enough, the condition can be reversed by switching to a healthier lifestyle. Start with step 1 below to find out more. Identifying symptoms of prediabetes. Look for increased thirst and hunger. Two of the most noticeable symptoms of prediabetes are increased hunger and increased thirst. Prediabetes causes you to urinate more frequently, resulting in a loss of fluids. This loss of fluids leads to increased thirst. In addition, the loss of fluid makes it harder for your blood to transport energy in the form of glucose to the body's cells. You will find yourself eating larger quantities of food and feeling hungry more frequently, as your body tries to compensate for this lack of energy. 1. Look for frequent urination. One of the most obvious symptoms of prediabetes is increased urination, which may develop abruptly. This happens as a result of the increased blood glucose levels, as not all of the glucose can be reabsorbed into the bloodstream. This causes higher levels of glucose in urine, which draws water from the blood and results in increased urination. People with prediabetes may have a daily urine output from 4 liters (1.1 US gal) to as much as 30 liters (7.9 US gal). Another way to confirm prediabetes is to look for high levels of glucose in the urine. Look for muscle weakness and fatigue. When the body loses large amounts of fluid due to increased urination, the blood is unable to transport the necessary energy to the body's cell, leading to muscle weakness and fatigue. As a result, prediabetes patients may find themselves feeling constantly tired and out of energy. Look for blurred vision. When blood sugar levels are high for a long time, body water may be pulled into the eye lenses, causing them to swell. This leads to impaired vision in a condition known as diabetic retinopathy. It is a common complication of type 2 diabetes. Look for pain or numbness in the extremities. When blood glucose is poorly controlled, blood vessels throughout the body begin to function abnormally and undergo structural changes that result in inadequate blood supply to the extremities. This leads to pain and numbness in the hands and feet. The pain is sharp and stinging, while the numbness can be described as tingling or a funny feeling in the affected area. The decreased blood flow can also prevent wounds from healing properly, which is another sign of prediabetes. Look for erectile dysfunction. One of the complications of diabetes is autonomic neuropathy, which can cause impotence among male patients. Autonomic neuropathy causes damage to the nerves and arteries in the genital area, which interferes with the blood flow necessary for an erection.